Back on again. Now today we go take a look into the so-called healthcare system that they got in America. And we go get into that because we can't understand how of all the places in the world, America got the highest rate in the so-called healthcare business. And it's a big money maker for them, milking the masses with treatments and those medication. And of course, they're not really doing nothing to help the masses. That's what you need to know. It's nothing but poison and chemical they give you in those so-called medication. But we go get into it in this so-called healthcare in America. Let's do it.
And on another healthcare story, Congress is still trying to work out a compromise on a different pocketbook issue.
And always fooling the masses with your so-called Congress. They're working on it to help the masses. That's just dumb to me, people. You believe it, that they're working on something to make it better for you? You better wake your ass up. It's nothing but dumb shit they're doing, fooling the masses. 100%.
Eliminating surprise medical bills. The problem can drive many people into deep debt.
You hear that? Surprise medical so-called debt. And of course, it can drive people deep into debt. And don't think it's a joke, people. Just a ride on the ambulance can cost you a fortune. No doubt about it. Pay attention.
Economics correspondent Paul Solman has a report on that debt and a unique effort to help people in need. It's part of our series, Making Sense.
Yes,
61-year-old Gwendolyn Quezada had
61 for your number 7. And don't worry about the people that they bring forward playing victim. And you're 9 right there. And you see all 6s, all fucking coded on the masses. But I'm going to wake you up. Once you see them on TV, post up. They're not no victim. They're just a part of the agenda, fooling the masses.
Your fatal stroke last year.
They had told my son, if I come through, I would be a vegetable.
The North Carolina resident managed to defy the experts, but not the economics.
Hearing the bill collectors calling you about hospital bills, that you know you don't have the money.
How much were your bills?
What you gotta understand, people, they don't care if you have the money. That's why they do it. You understand me? They rather to charge somebody the money that they know don't have it, because they like to keep people in stress and bondage in the satanic earth. That's how they do it. The medical bill is a part of it.
Over $6,000.
$6,000 is according, and I already told you why they do it. This is just a fake victim they put on, but just pay attention.
After insurance.
You have the doctor. Then you have the...
Why they have to have the cross behind this person right here. More than one cross. Just post up. Why? You better wake your ass up on the Christmas tree. It's coded for the dumb shit they give you. They call holiday.
Texas teacher Reagan Adair owed $10,000 after migraines landed her in the hospital.
You see migraine under put her in the hospital, and it cost her $10,000 with a bill right there.
It's got to be the most embarrassing.
Watch this, all cross, people, cross, and the star right there. I told you, just code it.
And to have to go through.
And after 13 strokes and 2 heart attacks, John Fouch simply says,
I don't have the money. I don't have a job. I can't pay it.
These are a small sampling of the many millions of Americans who collectively owe nearly $1 trillion worth of medical debt.
Wow, almost $1 trillion worth of medical debt. Wow, people, that's too much. And I told you, it's just pressure on poor people. That's how they do it. You can never live comfortably in this satanic earth. And by the way, that's how they keep you in a mental bondage.
Percent of all collections in this country are medical. Of the 100,000 collectors that we have in this country, 50,000 or more are medical debt collectors.
Craig Antico and Jerry Ashton used to be debt collectors.
Were you embarrassed to tell people you were a debt collector?
I introduced myself as resolution management.
Wow.
I say, I run a collection.
Don't worry about the so-called debt collectors. They're the same damn people. It's government companies they're so-called standing up for. What you think, people? It's them, the same fucking people. I already told you with the example of the IRS. When you owe them, they basically have a lot of companies that the IRS put together to basically give you a discount and so-called let you pay less just to get you to pay. Of course, they will compromise with you, have you pay a little bit less. But of course, you just have to pay bottom line.
What was their reaction in general?
Oh, you're the leg breaker.
What do you want? $140. You got it? No. Come on, let's tear it up.
Now, it's not as if legally licensed debt collectors bear any resemblance to gangland toughs. But But the objective is the same, says Jerry Ashton.
The bill collector is the enforcer for the financial industry.
And what people really don't understand, you're not supposed to be scared of no bill collectors. You understand? What the fuck can they do to you? Nothing. You believe they put them on so they could get the money from you, or they so-called buy out the debt from the so-called company that you owe, and they can force you to pay? No, people, they use scare tactics, but of course, it's the same fucking treatment of the so-called people that you owe at the first time. You understand? Not because they're tracking you down, calling your number, and harassing you. That don't mean you have to pay them shit.
Anybody who
Same
lends
damn
money
thing.
out there,
Don't be scared
they
of
expect to
them.
be paid. So if they can't do it, then they rely on third parties. And if the third parties fail, then they will consider, such as with hospitals, of selling their debt into the open market, the debt market, for a few
Sell
cents.
it to the open market, the debt market, and I told you already, people, it's the same government people. They have a whole bunch of strategy how to get their money when the public owe them.
On the
That's how
dollar,
they do
And
it.
then the collection companies try to collect the whole thing.
Chasing down borrowers in default, regardless of their ability to pay. Consider 94-year-old Elton.
Take a look at this right here, people. You see the pumpkin in the background? That's just a code in Freemasonry with the orange pumpkin.
Consider 94-year-old Elton Nielsen, a Navy veteran of World War II.
Were you under fire ever?
Oh, yeah.
And of course, bam, he go show up with the black eye. What happened to him, people? Somebody beat him up? You better wake up. It's just for the one-eye symbol. And don't trust none of these so-called war vet. As you could see him with the eagle on the hat. You already know who he work for. Safe
Normandy.
back.
Oh, hell broke loose.
You were in the Philippines too?
Oh, yeah. Dead bodies all through there.
Nielsen lives off Social Security and subsidized housing, is covered by VA benefits and Medicare. But even he has co-pays and deductibles for ambulance trips, ER visits,
See that ambulance trip? You hear that? ER visit. And I told you already, people, that's what the American press the people on. No doubt about it. Right there. You get vulnerable when you're sick and need health care or need help. That's when they get you 100% in. Even if you can check into the hospital, there's a bill gonna be waiting for you.
center care after numerous falls.
Do you get phone calls
Yes,
from the
he
collection
called.
agency?
Oh, yeah.
Really? What do you say to them?
I do the best I can.
As would most of us. One problem when we don't, embarrassment.
I feel bad.
Can I give you some information?
Retired MD Susan Soboroff.
Often when people owed us money, they didn't show up for appointments. And of course, there were consequences. People with chronic illness had more
You hear
problems.
that? The people no longer show up because they owe. Even though they need the so-called care, they rather not to show up because they owe the peoples already.
They
Wow.
didn't get their prescriptions filled. They got sicker.
And what almost no one knows, I certainly didn't, is that most medical bills can be contested. As many as 80% have errors. They can be past the statute of limitations. And then there's the charity care exemption.
About 30% of the accounts that get placed for
Of course, it's 30%, but what you gotta know, as I just tell you, people, you don't have to pay shit. No matter how much they stalk you and pressure you, you don't have to pay. That's what you need to know.
collection, they qualified for charity
them
care.
shit.
If they make less than 2 times the poverty level, they get it, no questions asked. But people don't take it.
Yes,
Oh no.
People don't take it or it's not presented to the people. You need to wake up. Those are the shit that they would never tell you, basically, when you're in that type of situation.
That's not for me.
Because it's a stigma, you mean?
Because it's a
Right.
stigma,
Get out.
and they're proud.
Bullshit.
Now, Antico and Ashton knew all this as debt collectors. But then the crash of '08 hit, and the Occupy Wall Street
Yeah, this-
movement began.
All fucking government programming set up for the masses. Everything they do is by design.
Right
people.
outside their office window.
Behold the face of the new America.
Intrigued by the movement's focus on debt, Ashton started attending and blogging about it. Eventually, he
Bullshit.
persuaded Antico to help him start a nonprofit, RIP Medical Debt, that would raise money.
Yes, they're gonna raise money to take care of medical debt. You believe that, people? I'm gonna ask you again, do you believe that this is just a smokescreen, a hoax for the masses? They can never get rid of this right here because that's why America was built on. That's what it built on. Yes, rob the masses in the healthcare name.
To buy up and forgive seriously delinquent medical
Bullshit.
bills.
You're not gonna
It was
do
a
that
slog
shit.
and a half.
How do you make a living as a debt forgiver?
You have to get donors
Yes.
that are willing to pay your
Yes, you
salary.
hear that? Of course, they're getting into the masses' pocket for donation. That's how they do it. You need to wake up, people. That's why you see so much GoFundMe. set up for medical bills. No doubt about it.
Okay, for the first 3 years, we made hardly anything, and my wife was saying, why are we going into debt to help people get out of debt?
I ran up all my credit cards.
Full of shit, people. 100%.
Borrowed from my own family.
My wife gave me the silverware and her jewelry to put into hock.
I hocked my guitar that I...
Bullshit there for the masses with the orange share in the background. Do you believe these two characters right here? They're nothing but thieves on the masses.
Let's play with as a folk musician.
I have 5 boys, and 2 of them had to stop going to college.
And then when did it turn around?
In May of 2016, we got on a nationwide show.
So are you ready to do this?
That's investigative comedian John Oliver.
Wow, and of course, people, they're gonna turn to Hollywood to help them out. Pay attention.
Whose HBO show had actually created a company to buy and forgive uncollected medical debt.
Of course, you use a comedian. This is a joke right here, people. I told you.
We were soon offered a portfolio
What is he holding on the hand sign, the 666s, is just bullshit for the
of
people.
nearly $15 million of out-of-statute medical debt from Texas
For your number 6.
at a cost of less than half a cent on the dollar, which is less than 60 grand. So we bought it.
But needing help to forgive the debt without creating tax liabilities for the debtors, Oliver turned to Ashton and Antico's struggling nonprofit.
They will commence the debt
Look at his hand sign, people.
forgiving process. So what do you say? Are you ready to make television history?
That segment put RIP medical debt on the map.
It's done! It is done!
That's another way to rob the masses through donation. You're never gonna get it. Big old bam.
They billed our insurance company over $3 million for the cost of transplant.
Wow, $3 million for the cost of transplant. Pay attention.
And I have another EOB right after it, which was another $1 million. So you're looking at a $4 million transplant.
Wow.
I don't know what people...
$4 million transplant, people. And of course, trying to tell you right here that you need to have insurance, because if not, you're going to have to pay that whole $4,000. But if you have an insurance, maybe you pay like $500,000 or maybe $1 million. That's just how it is.
Do without insurance. How could you even begin to pay that?
Yes, insurance is a fucking robbery on the masses. That's what you need to know. All healthcare insurance is a robbery in America.
So much about how expensive medical bills are, we've almost become numb to it. In 2017, 1/3 of the money raised on GoFundMe went towards medical campaigns.
You hear that, people? 1/3 of the money raised on GoFundMe go to medical bills.
And the site raises $650 million a year for more than 250,000 medical campaigns.
Show me your room?
Luca was born with alveolar capillary dysplasia and Hirschsprung's disease.
Yes, you hear what he born with? All that fucking shit that they give you. I told you already, people. Why would this baby born sick? You're not getting it, people. It's chemical they use on the mama and also this young baby. That's how they do it. You need to wake your ass up. Some kind of chemical reaction they have right here.
At 3 weeks old, he had surgery to remove part of his
He's 3 weeks old.
colon. At 2 months, he went into cardiac arrest, and at 5 months, he had a lung transplant. His parents had to turn to fundraising almost immediately just to keep up with the medical bills.
They did.
See? Pay attention, people, because this right here is a setup for the masses.
A clamshell approach, and he has several scars from all of the other surgery.
So when did the U.S.
approach, and he has several scars from
Where's the scars? We don't see no scars at
all
all.
of the other surgery.
Not even one.
So when did the U.S. healthcare system go from a philanthropic program to a multi-billion-dollar industry?
It was all by design, people. Just wake your ass up. It coming from a so-called programming. You better wake up, people. It's money. They make it to generate from the people, which is you.
Where do the funds go once the bills are paid?
Yes, let's see.
Today, the U.S. healthcare system is in a sort of tug of war between physicians, hospitals, pharmaceutical companies.
Don't let them fool you, people. It's no tug of war. It's them. It's the whole system. You understand? This, every fucking thing that you see right here is a system. It made up a system. One don't work without the other, and the whole system put together to rob the masses. You got it? Just wake your ass up. Don't let them fool you talking about the tug of war. These people right here is what taking the masses' money.
Shareholders and insurance companies.
Wake your ass
The
up.
list
The
goes
whole
on.
thing.
But for this video, we'll just focus on these entities. Caught in the center of it all are the patients.
We're often not able to provide the type of care that we want because of the cost of care.
And those costs are now forcing a growing number of uninsured or underinsured Americans into traveling abroad for medical treatment.
Everyone's Yes, it's so expensive. People going abroad, even to Mexico. And I told you already, people, if you just check the whole wide world comparing to America with the healthcare fucking price, and you see what I'm talking about, it's just sky high. All that the damn people rich. If you're not rich, rotten rich, it's like the healthcare gonna pressure you, put you down.
Thinking of healthcare as a business where the metrics were profit, return on investment, efficiency, and those aren't the metrics of health, but that's how we judge hospitals today.
You would think that they would be looking out for your chronically ill children and the, you know, all of the medications and things like parking at the hospital.
Yeah, right.
No, it's not covered.
But before we get to all of this, let's
watch what this one just did right there. Put the 666 on the hand sign right there. Don't believe me? That's what they do.
rewind to understand how we got here. This chart is a pretty good place to start. The data shows healthcare spending versus life expectancy. The rest of the world pretty much stays the same course. But around 1980, the U.S. veers off.
Watch the U.S. people leading the way right there with your healthcare. And I told you what it is already. Just robbery to keep the masses in bondage.
I like to say it's kind of the road to hell is paved in good intentions because everything we've done was in the name of better health.
It's bullshit, people, but it's in the name of good health. It's in the name of better health, everything they do. You need to wake up, people. You believe that? The whole fucking plan was to poison the masses and at the same time have their hands in your pocket.
To be clear, growth in U.S. healthcare spending has slowed over the past few years, but it's still way higher than in other wealthy countries. Before government programs like Medicare and Medicaid, Blue Cross and Blue Shield were the main providers of
health. You hear that? What I don't tell you, people, it start out, it's government shit. And from day one, now you used to have Blue Cross, or Red Cross and Blue Shield. The same fucking shit come with the cross, showing you that it is devil control shit. The people just sleep. And what I tell you about the Red Cross, setting up blood drive to drink the masses' blood, dumb on.
Insurance in the U.S. At the time, they were nonprofits and accepted everyone who wanted to sign up. But at this point, it wasn't to control costs. It was really insurance in a worst-case scenario. And after World War II, employers...
Always after the World War, people. The World War is what set the agendas for the masses. You're not getting it, people. That's what they do with wars. It's not really a war. It's a fake shit to pass agenda.
Started offering health insurance. Suddenly, demand was booming.
There you go.
From 1940 to 1955, Americans with health insurance went from 10% to more than 60%. That demand created a business opportunity.
What happened, people? People start getting more sick. I told you, people, the more we advance in life, is the more sicker people get and the quicker they die. Why? The more advanced food that they got for the masses, your vaccine and all. You understand me? It's a design to poison the masses. And don't worry about your so-called medication, because it's gonna give you a deeper way to die. An easier way to die you're gonna get from the medication instead of saving you. Might make you feel good for now, but of course, nothing good come from chemical.
And for-profit companies started rolling in.
Insurance was the first sector because it's in some ways the original sin in the sense of it separated the consumer from payment, right? So it felt like nobody was paying.
By 1950...
Oh, it separated the consumer from payment, so it feel like nobody was paying. First of all, no insurance relieve you of every fucking cost. You understand? You still gotta pay something.
Aetna and Cigna were major players in the...
Your Aetna and Cigna, it's the same fucking people. From your Red Cross and your Blue Shield, it's the same government shit. Just wake up on it, people. All of these fucking insurance, all of them is devil people. You understand? That's what they do. They cover all angles.
For-profit health insurance market. And in 1965, President Johnson established Medicare and Medicaid.
This medical insurance for those over 65 will become effective July...
Those over 65 for your number 11, but 65, pay attention right here, people. And plus it's 1965 also, all coded.
...will become effective July 1st.
Even so, the for-profit insurance market continued to gain steam through the 70s and the 80s, capturing more and more of the health insurance market. Meanwhile, the first for-profit hospitals started popping up around the country.
Here we go.
When Medicare...
That's the reason why they do it, people. It's a train reaction that they already know about. It's set up by them. That's how they get you to start paying so much for medication.
Medicaid started, there were none. But by 1983, 1 in 7 U.S. hospitals belonged to an investor-owned multi-hospital system.
You see that right there, people? I already told you. What you think made up the whole healthcare system, the hospital involved too. You understand? The whole thing, they control the whole system with your healthcare. You understand? Don't be thinking that one responsible and the next one don't. The whole thing make up the system.
By the 90s, Blue Cross and Blue Shield had merged, but they were losing money.
And all of them people is coded. Watch the Blue Cross right there. What is this right here? Somebody stretched out the hand to make the cross, and it's also sitting in a cross. And watch this right here, your blue shield with a damn serpent. And a lot of people never understand why they give you a snake, people. The same way they give you that Bible story about Adam and Eve and the so-called snake, the serpent tricking Eve into let Adam eat the apple. You see what I'm talking about? All biblical coding.
Fast. And in 1994, they let their local companies turn to Wall Street to stay afloat.
Here we go.
Hospitals, I think,
all of them enter into Wall Street for a reason. You never get it.
We're the first to realize, whoa, we can charge whatever we want for these things because it feels like no one's paying. But then, there are all these doctors in the hospitals. They see all these business consultants coming in. They see the hospital CEO making, $2 million a year, and they're feeling like, wow, we're suckers. We're working our tails off here, and we want in too.
Essentially, hospitals went from being run as a philanthropy to being run as a corporation. But these corporations...
What the people need to know is that was by design. That's how they set it up. The people just need to understand that. That's the way they set it up. Like I don't tell you about the train reaction. It's all by design.
Selling just another widget. They're putting a price on human health. The healthcare industry is now the country's biggest employer, and those employees need to get paid. Throughout all of this is private capital, and lots of it. You would think that if hospitals are becoming more efficient, the cost to consumers should go down too, but that hasn't necessarily been the case. And a lot of that has to do with the billing system. Of course, doctors need to get paid. There are admin costs and medical supplies and technology. But instead of this 3-page bill you'd get in Belgium, medical bills in the US look more like this.
I am my son's secretary, and I spend a lot of time taking care of just medical bills and phone calls and that type of thing.
We talk a lot about the billers and the coders and the consultants who really are removed from healthcare. They're not there because they care about health. They're there because they see a business opportunity.
Yes, it's more money from the masses, and the more money they suck from the people is the more those people in bondage in the system.
And, you can't blame them in the sense that that's what their companies are supposed to do. They're looking for business. So a collection agency that does healthcare, to them, a bill is a bill is a bill. They don't care if it's for somebody's heart transplant or someone who was not very judicious and spent a lot more money on a Rolex watch that they couldn't afford. It's a bill.
But how come those bills are so long? It has to do with something doctors call unbundling. Think of it like buying a plane ticket. You pay for the ticket itself, but there are a lot of extra charges squeezed into your final bill. $30 for a checked bag, $50.
And this is the same. This is a good example you're using right here, because like I tell you, the train reaction is by design. It's the same thing with these baggage right here. You understand? They say one airline come up with it, so-called Spirit, start charge people separate for bags. So you purchase a ticket. If you never mention bag, you can't bring no bag near the plane. You see that? That's the same way they set up the healthcare system. Don't be thinking it hit them by surprise. It's by design.
$1 for a few extra inches of leg room and another $3 for water.
Yes.
You get the gist.
People get irate about it and an airline ticket, but in healthcare we've kind of come to accept it as, oh, that's just normal. And part of the reason I wrote the book is to say that's not normal.
That's the reason why you're on, because you're writing books on it. I told you people, only the ones that milk in the system is a part of it. All of them. You understand? Once you see you write a book right here, publishing it and giving you a story, don't take nothing from them.
Hospitals do this through a complex system of codes. New patient visit, 9920105. Emergency room visit, 9928185. Burn due to water skis on fire, V9107. Yeah, there really is a code in case your water skis burst into flames. As they do. Different codes mean different prices. Just take the codes for a laceration. You'll be charged a different amount depending on the size of the cut, where it's at on your body, and how complex the suture is.
Coding historically was about tracking diseases, right? But in the U.S., pretty much...
That's nothing to do with that shit. You understand? Tracking diseases. I told you they just find a way to charge you more. Yes, more complications.
how you code a patient interaction is a billing construct. Again, something that had scientific and medical purpose gets translated into a business asset.
Every day we spend hours going through checkboxes, typing notes, documenting things that we're supposed to document.
All of these fuckers you see on screen got bookshelf behind them. Yes, I guess you would listen more and more keenly once you see books behind them. It just means they're dumb. Here they go, people playing with the masses with your Mitch McConnell right there and your Donald Trump. Mitch McConnell played doctor and the Donald Trump is nothing but bullshit for the masses. All of them in are robbing the masses through the damn healthcare.
Mitch McConnell unveiled new modification.
Hand sign, people. You never get it. Why is he all in the Illuminati pyramid on the hand sign? It's a devil puppet, 100%.
To the GOP healthcare bill today, in his latest attempt to sway 50 Republican senators to get...
Watch this one right here with the white around the eyes, just like Donald Trump. You believe in them? They're all fake people. Don't believe that some of them is better. And I noticed this because the Nancy Pelosi so-called in charge of the so-called impeachment, the dumb shit that they got on the masses because it's not real. Yes, a lot of people say, oh, we like Nancy Pelosi, but you never get it, people. All of them is the same. 100% in. They might make you feel good for this minute, but of course, at one point, you're going to get to see that they are tricking the masses with this ego right there beside him for the free
behind repealing and replacing Obamacare. The new bill adds 45...
Obamacare is another fuckery again. They give the masses, you believe it here to help you? Pay
$1 billion.
45 for your number 9, but that's how they do it, people. You believe it that the so-called Obamacare gonna help the masses? No, people, it just put you in a deeper fucking shit with that Medicare. You understand? You have to search every fucking time to find a cheaper doctor, and the doctor that you might be used to or close to you, they're not gonna take that so-called Obamacare. So what the fuck is it about? You're not getting it, people. It's just another bullshit for the people.
To help states deal with the opioid crisis. A nod to previous holdup.
People, this $45 billion right here is to treat opioid crisis, the one that the government made. You're not getting it, people. The same drugs that they're talking about in the so-called healthcare shit. Yes, now it's an epidemic. They have to spend $45 billion to cure it. You see that? How did the America get to addicted to opioids? Why? You never get it, people. The system was designed just for that right there, to program the masses into these so-called medication. What do you think it's doing for you, people? You better wake up. It's nothing but chemical.
Rob Portman of Ohio and Shelley Moore Capito of West Virginia. It also allows bare bones plans to be sold to the Obamacare exchanges, a pet policy of Senator Ted Cruz.
All of them in on it, fooling the masses with this Obamacare. Don't believe that it's good, people. Wake your ass up.
I think we're making serious progress towards coming together and unifying our conference and getting a bill that can command the support of at least 50 senators and pass into law.
This version of the bill also has a provision.
Yes, whenever you see them right here, people, it's just a show for the masses. You're never gonna get it. It's just a show.
Members of Congress and their staffs a wider array of benefits than other Americans who actually purchase their own coverage. McConnell says the Senate will vote next week.
Nothing but some fakers on the masses. Red tie, blue tie, purple tie. And what you think red and blue give you? Your division, okay? And it's still the same purple when you mix red and blue.
The group that's been consistently opposed to Obamacare repeal of any kind is the American Medical Association, the country's largest organization of doctors. Michael Moynihan went to see some specialists to find out what's going on with the future of government health care and himself.
Okay. I'm just gonna put this on the floor. I'm like legitimately nervous. I think I have cancer. I always think I have cancer. You know what the major problem with American healthcare is? It's paperwork. Are you kidding me? 10 or 12 pages? VOHC? Do I need glasses?
Going to check right now.
Shit.
Excellent.
Okay, let's talk about Obamacare. We will. Sure?
Yeah.
Yes, show up in a purple thing right there. But I told you, people, all of this right here is to brainwash the masses. You think this one right here gonna uncover something for you? Let's see. Let's check.
All right, let me just take a look here. A typical insurance on an initial visit like this, which takes me 1 hour, pays about $100 or $95.
Look at this right here, people. An X at the top and a serpent around a pole. Wow, don't trust them, people. Wow.
The cost of that hour for me to just keep the office open and operating
Watch the little man had the sign on the hand at the so-called doctor.
is about $300.
So when
insurance is a cost.
is actually paying for it, they're not paying you enough.
They pay me a lot less than the visit is worth.
So that's why you don't take commercial insurance.
Right, because I couldn't afford to do it.
This is going to be your glasses.
Are you kidding me? You're fucking, I'm sorry. Do I need glasses?
So far, yes, a little bit.
Yeah. If I'm self-paying with you, how much does it cost?
That's a really good question.
You don't know.
I think it's $350, but the front desk actually knows that price better than I do. So I am
Can I
not.
ask you a question? Is it odd for you not to know?
I don't want anything about my care to be influenced in any way by what kind of insurance you have.
Oh, shit.
Yeah, that's okay. You're looking straight ahead for me.
I don't like this part, by the way.
Yeah, I know. No one likes it. Everyone gets mad at me with this.
Really? This is quite nice, though.
In terms of the impact the ACA specifically has on the practice, it has increased the level of administration that we need to do in order to get through the day. So we used to be about 10% administration and 90% clinical, and we're now like 40% administration and 60%.
Wow. And I told you people, you need to wake up on this right here. It's by design to milk the masses with your healthcare. 100% in.
We have this idea in this country that when it comes to healthcare, more is better. You can't be too thin or...
You hear that? When it comes to healthcare, more is better. Of course, and it's gonna cost you the more you have. You understand me? Go back.
Healthcare, more is better. You can't be too thin or too rich, and you can't get enough healthcare.
Wow.
We all come to a similar conclusion that about 30% of U.S. healthcare spending is devoted to unnecessary services. And that's,
You hear that? They're paying for unnecessary services, but how did that come about? The damn doctor, you understand? They're the one who tell you what you need to get done, and then they charge you for it.
$100 billion a year.
You hear that? Billions
You don't
of
have a
dollars.
significant blockage. One person's waste is nearly always another person's income. And income turns into strong political defenses.
Why does American medicine cost so much? And if we're going to pay so much for it, why don't we get better results?
No, just say, why don't it work? That's what you need to say. And why is it addictive? Because it is chemical. You're not getting it, people. They just talk about the so-called opioid addiction in America. It's gonna cost them $45 billion. You're not getting it, people. How the fuck those medications come to be addiction to the masses? People take them even when they don't want them. That's bullshit, people.
Film coming up on PBS next Tuesday night, the 25th, takes that question on directly. It's produced and directed by Roger Weisberg. Roger, welcome to the Online News Hour.
Thank you.
I told you, this one right here bringing you a documentary, just like the one I show you, bringing out a book, and that's why they on. You believe that they come to shed a light on something? No. Only thing they're shedding a light on is their book and their fucking documentary. Come on.
Well, you showed us, instead of just telling us, a lot of the cost drivers in money in medicine. What are the main culprits for making American medicine so expensive?
Let's see.
Well, I think there are a lot of drivers. There's the aging of our population. There's technologic innovation.
Oh, the aging of our population. What that mean? People is getting older? Well, you mean people getting more complication as they get older. That's what you mean? Let's go back and see if we can figure it out.
What are the main culprits for making American medicine so expensive?
Well, I think there are a lot of drivers. There's the aging of our population. There's technologic innovation and explosion. But I think the biggest single driver
Of course, he in a purple shirt. Wait.
is our fee-for-service system that rewards volume instead of value and quantity of medical services instead of quality. And as a result, we end up doing a lot of things that cause more harm than benefit for patients.
But if we said to people, hey, I can do less or I can do more. If they're sick or someone they love is sick, hey, I can do these extra things that might work or I can do nothing. Isn't it human nature that they'll choose more?
Wow.
I think there's a pervasive view that more is better among consumers and among a lot of healthcare providers as well.
More is better.
But what we're beginning to learn is you reach a point where excessive diagnosis and treatment reaches the point where you're doing more harm than benefit in a lot of cases.
What I don't tell you, people, they make fake diagnosis. That's why the doctor is there. And I told you, a lot of shit that they're pushing, all the doctor have to do is diagnose people with it to make the number go up. But they're fucking fakers, 100% in. And if you got a cold, they diagnose you with a deadly flu. Yes, you need the vaccine. It's bullshit. 100%. And I told you, people, all tore off you get from the news. You believe they're real? They never tell you nothing real. They're promoting their documentary and their damn book. catch me on the run.